like to tell patients to think about the chest, and you have your right lung and you have your left lung, and then you have everything in the middle. And that everything in the middle is the mediastinum. We further break that up into 3 separate compartments, the front, middle, and back, or the anatomic terms are the anterior, the middle, and posterior mediastinum. The different types of masses can form in the mediastinum depending on where they're located. So let's start with the anterior mediastinum, or that front compartment. That's going to be anything in front of the heart. And in adults, the most common type of mass is something from the thymus. The thymus is a fatty gland that sits in front of our heart, and it's very important when we're babies. It helps to make T cells for our immune system. As we grow older, that gland becomes less important, and it essentially starts to melt away, but it sticks around just enough to cause problems, and you can get different types of masses of the thymus gland. Those can be benign, or they can be malignant or cancerous. So that's the most common type of mediastinal mass in the anterior mediastinum in adults. You can also get lymphoma. You can have thyroid goiters start to come down into the anterior mediastinum. And then the last type of mass that we will commonly see is something called a germ cell tumor. That is also commonly referred to as a teratoma. In the middle mediastinum, that's going to be duplication cysts coming off of the airway, so the trachea and the esophagus. And they're basically little outpouchings that form during development. And they start off teeny tiny when you're babies, but they grow larger over time and can fill with fluid. And those can cause some obstructive type symptoms that will need us to go in and resect them. And then in the posterior mediastinum, you can have nerve sheath tumors and paraganglioma tumors as well. And those are going to be tumors that are back along the spine.
Probably about half of mediastinal tumors are asymptomatic, and they're found incidentally on a scan being done for something else. Symptoms that we see most commonly tend to be compressive type symptoms, where a patient feels pressure in their chest from the space that the mass is occupying, or it can compress their heart. They can compress their esophagus. They might have difficulty swallowing. It can compress their airway. They might have a cough. If it shows up in the posterior mediastinum near the spine, a lot of times it will present as a pain.
Not all mediastinal masses have to be removed. If it looks like a simple benign cyst and we're fairly confident, then that's something that can be monitored over time with subsequent CT scans. Similarly with these small duplication cysts in the middle mediastinum, if they're not causing symptoms to the patient, we can simply observe those as well. However, if they do look more malignant or concerning for any type of cancer, not lymphoma, that's the one exception, then we will recommend surgical excision.
The surgical approach to mediastinal masses is dictated by their location. The majority of these masses can be resected with a minimally invasive or robotic approach done between the ribs on the outside of the chest. Some of the larger or more invasive tumors will require a median sternotomy. For smaller mediastinal masses that can be resected robotically, generally patients will spend a single night in the hospital with a short recovery at home with no physical restrictions. For larger or more invasive mediastinal tumors that require median sternotomy, the patient can expect about 8 to 12 weeks of physical restriction and activity limitation while the sternum is allowed to heal.
What I like to tell people is, for me, I see this all the time. This is routine for me. I know it's not routine for you, and so therefore it is going to be overwhelming. But what I like to assure my patients is that the majority of masses, once they come out, they don't require any additional treatment. Very rarely do they require adjuvant or post-operative radiation or chemo. Most of the time we're just simply talking CT scans going forward to make sure nothing comes back, nothing changes.